In this episode, I'm speaking to Dr. David Wiss. David became a registered dietitian nutritionist in 2013 and founded Nutrition in Recovery, a group practice of nutrition professionals specializing in treating eating and substance abuse disorders. He earned his PhD in public health with a minor in health psychology from UCLA. He is a scientific author with over 20 peer-reviewed publications. He's a nutrition and health consultant, functional medicine practitioner, recovery coach, and a passionate educator. More recently, David has created a new resource called Wise Mind Nutrition, which is an app that supports people working in the intersection of nutrition and mental health. During our too short conversation, we talk about the role of nutrition in recovery and some of the polarization in the eating disorder community. David creates some valuable nuance around what is often thought of in black and white terms, which is the diet culture versus anti-diet culture, and helps me understand some of the issues around ultra-processed foods and how they trigger addictive eating behavior. We had to wrap up while I still had a lot of questions left on my clipboard, so I'm hoping to speak to him again in the near future as I find his point of view very refreshing and found myself wanting to know more. But for now, please enjoy what is hopefully my first conversation with Dr. David Wiss. Hi, David. Thank you for joining me today.
Oh, lucky me. I'm so happy to be here. Thank you for having me.
Yeah. Full disclosure, I have like a clipboard full of sticky notes. This is so I don't forget all the questions that I wanted to ask you today.
I love it.
But, thanks for making time because I know that you just had your second child last week. So congratulations to your family.
Thus we grow.
We do indeed. I know nutrition for mental health is your jam. And some of the people listening might be wondering, why this is Hack Your Blood Sugar. That's what my pod really trying to stay focused on blood sugar here. And why are we having Dr. David Wiss on talking about nutrition and mental health? It's odd. I mean, David's probably like, duh, it's obvious to us, but I want to be explicit about it before we start. And I think the two most obvious reasons are that blood sugar regulation has such a big impact on mental health. And two, and this is kind of a selfish reason for me wanting to talk to you today, is that a lot of my patients, especially the ones who just aren't able to make the changes they need to make, there's some addiction in there. There's some trauma in there. There's emotional eating. It's a mental health issue that's under that. And I want to have some juicy conversations about that, in part just to get maybe some professional mentoring from you in the guise of a podcast interview, but also because I love to hear myself in a narrative and go, that's me. How do other people deal with that? You mean other people do this? What does that roadmap look like? And so that's some of what I really want to talk to you about.
So good. I would say that nutrition touches every aspect of life. There's some, connection to food, to health and, family and environment and mental health. You could say the same thing. Mental health touches all aspects of health, and something like blood sugar, if you think about it, it's a perfect place that touches nutrition, mental health, brain health, and the context of it all is super important. And I'm excited about your podcast and the stuff you're working on. And I'm also a huge fan. So thanks.
So just as background, I know you specialize in nutrition and mental health, and you founded Nutrition in Recovery some years ago. So and now you work with eating disorders. So how did you get into this work?
Yeah.
In a big nutshell.
Super nutshell. I definitely came into the field thinking sports nutrition was going to be my path. The early days were fitness, and it seemed like the trajectory for a guy like me, right? That I would get into exercise physiology, sports nutrition. And I did sense pretty early on that there was a shallowness there. And I don't say that to be rude or mean to anyone, that I just didn't think that I could do that for my whole career, and that I wanted to do more deeper work with people, more healing work that touched the soul level rather than just the outer level.
Mhm.
And that's where recovery work came in. I also have a personal recovery story. So, separated from some very harmful substances right around 2006. Um, and so I'm good at connecting to people that have had traumatic histories and that are searching, people that are on a path for healing. And so I'm able to combine my work in nutrition, my research in mental health, and my ability to connect with marginalized groups and bring it all together and say, let's talk about it.
Yeah. And what's interesting is, you talk about how, working in the sports nutrition kind of felt a little shallow and you wanted to do more soul work. And then connecting with people, who are going through recovery, who are going through this. I mean, do you find that when people are in that place, focusing on recovery, that is that where you like to interact with people because they're doing that deep work?
Yeah, it just feels so much more in alignment with my own call, the work that I've done personally.
Mhm.
It feels like there's room to get into other topics and to move the energy around in some different ways and be supportive on
Yeah.
a deeper level.
Yeah. And I read, tried, I can call it doing research when I'm inviting you on a podcast, but you could call it cyber stalking if I wasn't. So I was reading, things you've written and other podcasts you were on, I was listening to this week. And so I listened to some of your story, and it sounded like you had a personal big, I guess, response to improving your nutrition, like nutrition and lifestyle medicine, like changed things in a big way for you.
Hmm. I made a lot of changes all at once, right? So I really did have that hard reset on my life. I lived somewhere else. I started eating different food. I removed a bunch of stuff. I removed a bunch of people. I added people. I added sunlight. I added water. I added music. And it was just a real hard reset. So I get to say that I lived two lifestyles in one lifetime. Like there really is like my life before September 2006 and my life since, right? It really is that stark of a
Yeah.
contrast.
So so many of us in this profession, we have a story like this made such a big difference. You see this all the time. This made such a difference to me. Everybody needs to do it now.
Right.
So you took what worked for you. And then you developed the nutrition and recovery, and you've developed, like, it's being used in recovery centers around the state, in
Yes.
California where you live. And then you work one-on-one with people. This might be too much of a question, but I'm really curious, like, what were some of your biggest, what are the big things that you learned about other people in their nutrition lifestyle? Because you had such a big response. I'm assuming you'd be like, oh my God, this is going to change your life, dude.
Yeah.
Does it change everybody's life as instantly as yours? Or what's the kind of spectrum on that?
Thank you for that. I've always felt like I was smart enough to know that I shouldn't extrapolate my personal experience onto the general public, right?
Mhm.
That my experience was valuable, but I always had at least enough scientific training to know that there is variation in nature. And that, of course, when you study social sciences, you realize that people have different access to resources and different cultural backgrounds, right? So I've always differentiated myself from the beginning, knowing that there aren't universal truths and that one size isn't going to fit all. And that even things like group curriculum, which is what, part of what nutrition and recovery has to offer, has to be tailored to the population. Because I remember running groups in those early days, and I could teach on one day about the food industry and talk about some of the deceit that goes on behind the scenes based on, Michael Moss's original book, Salt, Sugar, Fat, which I think was 2014. Like when I read that book, I was enthusiastic about the truth and I wanted to share it with the world. And I could teach a group about some of the tactics of, major corporations, what's going on behind the scenes and how they are, manipulating food and engineering it for private profits ahead of public health. And I could get a bunch of people really excited to start cooking their own food and start reading the back of ingredient labels. And then you could put me into another group, and there could be a handful of people there that had a history of a restrictive eating disorder, right? And that type of a content might actually be kind of triggering for them to be able to say to someone who's 12 days sober off of a stimulant run with anorexia nervosa that they need to be flipping over ingredient lists and being really concerned. So I learned very early on how to feel the room, how to sense it out, right? To use intuition, clinical intuition, to know what might be good education to provide, what's going to be safe. And so I've really built my career based on this idea of nuance, of being able to say, this topic would work great here, this wouldn't be great here. How do you preface things? How do you disclosure, right? And let everything come across as being a wide range of possibilities rather than this is what's true. And I think we need more of that in the nutrition world. Unfortunately, when you do take a middle ground and you talk about nuance, algorithms don't really know what to do with you. You know what I mean?
It's not a good marketing strategy.
It's not a good marketing strategy. You have to pick a thing and sort of stick to it, right? You have to pick a target audience and just target them. And I've struggled with that quite a bit because I actually do the kind of clinical work that is considerate of a wide range of possibilities. And I've had people try to like corner me into like, just pick your target and just stick with them. And like, I can't. And it's not because I don't, have an identifiable target audience for the work that I do. I do, but I actually like the variation. I like having a client that comes in with ultra processed food addiction and then teaching them how to eat less chocolate cake, and then having another client who comes in that has a long history of bulimia nervosa and being afraid of food and maybe even eating a piece of chocolate cake with them. You know what I mean? Like I like having different things that I do. Goes back to my original career aspirations. I want to be able to do this for the rest of my life, right? So I want it to feel like important, intuitive soul work. And, I found that quite a bit. So my practice is very, very meaningful, and I get to do really good work.
So on that, I mean, you touched on a few things there that are really interesting. And one of them, and this you've brought up before in our professional world, there's a lot, and I'm actually not up on the lingo because I just don't take part in this very much, but there are divides. There's not a divide. There's a divide in, calling things diet culture and saying if somebody has an eating disorder, you can't restrict anything. Like they have to eat everything, even processed foods. And of course, the answer is nuance. I know that's the answer is nuance. But, I want to tell you a little story about a really nice conversation I had with somebody after you kind of wrote, I think, an open letter that you shared in the IFNA.
Yeah.
And that was my first introduction to you. So I won't keep that private. So David wrote, I should have read it before this, shared a letter of his to our nutrition community about the divide. I think, make sure I represent you properly, the divide where in the intuitive eating crowd, you had to say, eat anything's fair game and eat it all, versus, maybe there's some nuance. We do need to put some guidance on that so that you can support the body being healthy. And I thought I really appreciated that. I didn't realize that was so controversial. It seems silly that was controversial, but it is. So you inspired me to reach out to a local group because there was an intuitive eating group local to me, and I live out in the sticks. So anything that's local to me is like, oh, we could be best friends now.
Yeah.
And I said, hey, I'd like to refer people to you, but I've heard about this controversy. Sorry, I have a British person living in my house, and I never know if I'm supposed to say controversy or controversy. A controversy on this. Would you like to I said, could we have a conversation about that? Because you inspired me to and I made a new best friend. And it turns out this person was really receptive to some nuance and a conversation. Specifically, I asked her, and so I want to talk about with you at some point. I'm like, I use continuous glucose monitors with my patients because I want to give them insight. I want that to inform, like, oh, I feel like this, and that's what my blood sugar is doing. Oh, so if I do this, the data helps them see it, and then they start making those connections to listening in. There's a term for listening into your body, which I can't remember. And I said, tell me how you feel about that from an intuitive eating standpoint. And she said, you're building intuition. So she wasn't being really bloody minded about it. And so I'm curious now how you navigate that. Are you body positive, or are you trying to lose a little weight to improve fatty liver or whatever? Or are you restrictive, or are you completely permissive? How are you navigating that?
Yeah. So I think the greater issue that we're talking about is polarization.
Mhm.
And it is such a big part of our society as a whole. And I think the most obvious example is the bipartisan political system, right? We have a system where it does seem like we pump fear on the public, and people consume media and basically live in a heightened state of threat vigilance, fight or flight. And we're moving through the world looking for people that represent our inner group and people that represent our foes, right? Our outer
Mhm.
group. And that has been so clear in politics in the last few years. And then you start to see it playing out in other issues, particularly those that have social justice implications to them, right?
Mhm.
And you could see it, across the society, but for whatever reason, it became particularly pronounced in the nutrition space. And my theory is that because nutrition is connected to so many other social justice issues about uh, body body liberation, right?
Mhm.
Trauma from the healthcare system, food insecurity, right? Food access, uh, BMI, racism, like the list could go on and on. And those are all issues that people got really charged up on for good reasons.
Mhm.
And then it started to spill over into the nutrition world in a way that was very obvious to those of us that were on the inside, right?
Yeah.
So we had the classic biomedical model of nutrition, which some people started to call diet culture, right? Because it was basically centering on an assumption that all people should try to lose weight, right? And that pursuit of weight loss is a normal behavior, and that it's just part of society. That's why it's called culture, the diet culture. And
Yeah.
that went pretty far when the mega corporations started really um, profiting off of people's insecurities, right? Like if you can get people on board with diet culture and feeling bad about themselves, they are more likely to spend money on
Mhm.
memberships, subscriptions, etc.
It's a good marketing strategy.
It's a great marketing strategy. Make people really insecure and offer a solution, right? And then the counter movement, and a lot of people associate it with intuitive eating. I think the better way to describe it is the anti-diet movement,
Mhm.
right? Which is that people were saying, we're fed up with this. We're fed up with the doctor telling the 230-pound patient that all they need to do is lose weight, and until then, there's like nothing they could do to help them. We're fed up with smaller bodied cultures making assumptions about larger bodied cultures and all of the um, economic implications. Um, but interestingly, and I do identify as someone that's kind of non-diet. Like I'm not into um, like classic models of nutrition. And when I say classic, I mean calories and macros. I'm
Mhm.
more into gut health, mental health, right? More qualitative stuff.
Mhm.
I'm super into the CGMs, and what I do believe in quantitative. I'm a scientist, right? I do statistics, right? I'm
Mhm.
into it.
But you social science people, so you You do. There's qualitative, and you've got the quantitative. You have both backgrounds.
That's right. That's right. That's right. So I like the qualitative energy with nutrition because of the way that it interacts with the human brain. It stops thinking about it solely as a math problem and can put people into the context of like, eating food that represents nature, connecting to people at the grocery store, or all the parts of nutrition that are missed from purely quantitative models. But yeah, to wrap this up, the anti-diet movement swung in the other direction and was like everything that's promoting health is, harmful. It's promoting dieting, it's promoting restriction. And a lot of this came from the eating disorder treatment community, which I'm a part of. We do see the small percentage of people that are very harmed from counting calories and getting too far into that stuff.
I
And
think
so
you call
there
it
was
food math. I've heard you call it food math.
food math, the endless food math, right? Where like, and again, like I believe that there should be some math, but when someone makes a decision based solely on the math, that's when it's a problem. For example, there's people that would go into a grocery store like Whole Foods or whatever and would prefer to buy a packaged thing over going to the hot bar because they know the calories on the packaged thing and they don't on the thing. You see what I'm saying? Like someone would rather just have clarity and confidence in their numbers than like actually go eat the real food. That's when it becomes a problem. You get what I mean? So yeah, the anti-diet movement and the eating disorder community had to really take a really strong stance to counter some of this, and it went way too far. It went so far to the point where they were, canceling people that were promoting health on the internet, and that's what created this polarization that has made the nutrition field, especially for dietitians and people that actually just focus on the food, it started to feel like a really unsafe place. And I was one of the few people that was like, you know what, I'm not going to sit back and watch this anymore. We're going to talk about this. And I think that's what gave birth to that article, that first article that I wrote, is like, this is how the nutrition field became toxic. And it really has to do with people being susceptible to the programming from the mega corporations. The mega corporations love diet culture because they can make money off of that, and they love anti-diet culture too because that's basically exonerating them from concerns about their food. So they got behind that. They're like, oh, this is great, amplify these voices. We have healthcare professionals telling parents to feed their kids Twinkies. Perfect, right? Like, and it just became this toxic landscape where people were fighting amongst themselves, and no one was taking the time to ask who's profiting from all of this, right? Like, what's going on behind the scenes? What are the other social justice implications, and who's laughing all the way to the bank? And so I do think that conversations about nutrition should involve capitalism, economics, psychology, marketing. That's all such a big part of what we do in this field. And I've always been willing to go there.
And on that topic, ultra-processed foods and addictions reward pathways. Can we flip into like a little neurobiology?
We absolutely can. I
Because,
want to bookmark. Yeah.
Yeah. What do you want to bookmark?
I want to bookmark the ultra processed food piece because I have some thoughts there that I've been cooking up, and we'll get back to that in a few.
Okay.
Yeah. The neurobiology has been very well described, and it's very similar, if not identical, to what we see with alcohol and other substance use disorders, right? Which is that, the mesolimbic dopaminergic projection that starts all the way back in what people call the reptilian brain and influences, cognitive processes of logic in the prefrontal cortex, right? That someone actually has what some people would call a brain disease, to where the ability to weigh the pros and cons of certain decisions is compromised. And the way that plays out is going to be slightly different from person to person. For one person, is like once they start, it's so rewarding that they just want to keep going until they can't stop. And for the other person, they take something, a substance, and they're able to stop, but the brain liked it so much that it signals for it again the next day, right? So there's different ways that substance use disorders present for themselves. For some people, it really is like complete, like impulsive loss of control. And for other people, it just sets them up to be daily users,
Yeah.
right? And like, yeah, if someone's using, and that this is where a lot of the controversy comes in. If someone needs a dessert every night, and that's part of their routine, right? A eating disorder perspective might say, well, that's fine as long as they're not binging on it, as long as you have it, right? But a addiction lens would be like, well, what happens if you don't have it? Are you in a bad mood, right? Are you in a bad mood when you don't have your drug? And what lengths is someone willing to go to get it? So the way that I remember addiction, and I don't want to get lost in pathways, but there's a part of the brain called the ventral striatum, which encompasses other parts of the brain, but it's largely responsible for the assignment of value. It works with the hippocampus to remember experiences and substances that were valuable, and it measures value based on the dopamine response. And when something is dopaminergic, it's registered as valuable. It's basically stored as survival promoting. So that's why people will do uh, behaviors and ingest substances that can work against health, under the guise that it's actually survival promoting.
Survival.
That's how addiction works, right? You're basically overlearning a process or a substance and assigning it way more value than it actually deserves, and it starts to work in this opposite direction where you want it really bad because you equate it to being very valuable.
Right.
You might not even like it that much anymore, and it's working against your life, right?
Right.
But people continue to do it despite the negative consequences.
Yeah.
And it's
Yeah.
just
I'm thinking of a client right now, a couple, but one in particular for whom, type 2 diabetes, big, history of dementia in his family. He's terrified. It's really important to him.
mm-hmm.
But fast food is like a siren song for
Mm-hmm.
him.
Mm-hmm.
And gosh, it just gets the better of him. And he said it the first time. It's like I feel like I have an addiction. This is an addiction. And because I don't like to put that label on people, but he's like, this is what it feels like.
Mm-hmm.
And I have a question for you. I just finished the book, like Dopamine Nation. And it's less, I wanted something different from it. But one thing they do talk about is, they said that the first step towards recovery is always abstinence. The first step towards recovery is always abstinence. And I think about this client of mine for whom this, the fast food is just, you can't get away from it. It's really hard. So what do you think about the first step in recovery is abstinence? Is it always abstinence?
No, there's very few always is in recovery and in mental health. There are people that have the kind of addiction like neurobiology where without abstinence it's hopeless, right? There are some people where it's like as long as you're continuing to expose the substance, you're going to be obsessing about it, and there's really right. And this is something we see more with drugs of abuse like alcohol, methamphetamine. Food is different because there's so many shades of gray, right? But there are other people that need like a harm reduction approach where you're looking at like basically weaning someone off. And in order to like let's say someone's getting a large amount of dopamine from two big meals a day, right? You can't just like expect their brain to get like very little dopamine stimulation and be okay, right? The reptilian brain is going to show up. It's going to create negative emotions. It's going to create whatever narrative it has to take, get into a fight with someone. So you're on the way home and you go through the drive-through, like it'll literally spin reality in any way to get its needs met. That is what addiction is characterized by. So in addition to, that's why people go to inpatient treatment for like severe addictions, because like your brain's going to be going nuts, and you might need, that's why in addiction treatment, people smoke cigarettes and drink coffee and eat highly palatable food. you get into therapy, and like over time, you've basically like weaned yourself off of the really high dopamine, and now you're on lower doses of dopamine. And then you
Right.
think about what are some new sources of dopamine, right? New things in my life that can create motivation or make me feel driven or a sense of purpose, right? None of those things can actually compete with
Sense of purpose.
ultra
Yeah.
processed food or crystal meth or any of that. But yeah, I don't believe that everyone needs to be abstinent. I believe that once you recognize that there is addiction like neurochemistry, that you can start to reduce exposure to some of those things, find other things in life that are meaningful, and then over time, hopefully be able to, reduce some of that harmful exposure. And,
Yeah.
some people need to stay at a certain level for a little while, and then a new window opens up, like, oh, you got this new opportunity for a new job, you got to show up a little bit more, or you're going to go on a big hike and you're motivated, there's windows of opportunity that open, you're like, you know what, I'm going to pull the sugar out of the coffee now, I'm ready, right?
Okay.
And I think that in the recovery world, and I think maybe we started the conversation here, a lot of practitioners take their own personal recovery story and superimpose it on someone, like, oh, it has to look a certain way. And I've always been more of the person that's like, curious to see how it's going to look based on how it unfolds,
Mm.
rather than having a preconceived notion about how it's supposed to look. But in summary, as someone that has lived experience with addiction and someone that has studied it quite extensively, abstinence is a very realistic approach in general. But it seems that with food, a lot of people struggle with it. More and more people are declaring their independence from food companies and claiming abstinence. And I support it, But realistically, for most people, we think about, like, tiered approaches, titrating off, harm reduction, moving people into new chapters, and also being open to the possibility that your food plans and your nutritional needs could change over time.
Yeah.
Like, there's a difference in my eating when I was like in my PhD dissertation than when I was in, before school, going to sound baths and 5 yoga classes a week. You know what I mean?
I
There
do.
were differences in my eating when my wife was pregnant, and we were right versus other periods where there was less of a storm, and I think that piece is super important and probably relevant for the work you do with glucose, is that, like, there's inevitable variation and flux in the
Mm.
human experience, and like there is a need to embrace some of that uncertainty and to learn how to be resilient and to roll with it, and see the big picture rather than just the individual data points.
I mean, being able to see the big picture and be able to roll with things and not just the data points. I mean, this is getting away from black and white thinking.
That's right.
And I mean, you've alluded to this before, seeing the bigger picture, having a bigger purpose. I know that in like traditional recovery, spirituality is a big factor. It's a big component. Is that something, do you think that's always something that needs to be there for recovery, is a sense of connectedness, whatever you want to call it, spirituality, purpose, life purpose? Is that a really essential component for people when they're in recovery or dealing with any kind of addictions?
It seems to be part of the formula, but I've sort of concluded more recently that some people have, and I'm going to use this term, I don't really know that I stand by it, but it resonates, have older souls, old souls that have just a much higher need for depth, right? There's something about, I don't know if it's a generational legacy of trauma, right? If it's woundedness that creates more, or if it's certain people that don't easily opt in to the mainstream narratives and are constantly searching and seeking for something much, much deeper, that kind of generational trauma / old soul / seeker does track really closely that with people that have addictions. A lot of
They
people,
do. My
Yeah,
friends who have struggled with addictions their whole lives, they are always very sensitive, very deep, really need the meaning.
yes, yes. And so one theory is that a lot of people develop addictions because they just feel a little bit misplaced on earth, right? You're searching for so much more and all you get is kind of a shallow experience. We call it the 3D, the third dimensional world of form, where people just care about cars and the sports game and the news, and right, everyone like
Mhm.
basically does what the mega corporations want them to do. And then there's a small percentage of people that are sitting back and like, no, I'm not part of this. I don't belong here. This doesn't feel like home, right? And there's a searching and a seeking, and then the drugs and the alcohol are a part of that. And there's a lot of theories that we could cook up about why that is, but I think there's some people that develop addictions just based on circumstance. It's a perfect example of the difference between the old soul seeker who becomes a heroin user
Mhm.
versus the person that had a normal life, that had an injury, that got strung out on prescription medications and became dependent on opioids, right? Like,
Yeah.
is that the same, like from a clinical perspective, a medical doctor might say, you know, that's opioid use disorder, period, right? They're both.
Same diagnosis code.
Yeah, exactly. It's a diagnosis code. It's the same sort of thing. Whereas when you think about what might be the solution for the
Yeah.
person that has the dependence, they might need to just get off of the substance. You know what I mean? Maybe get some clinical support. Whereas the other person, the seeker, might need to find a community, a tribe,
Yeah.
get involved in altruism, find more purpose, meaning, and direction in order to
Yeah.
fulfill their lives and live a more meaningful, sober life. Whereas the other person was like, oh, I got dependent. We weaned off. I used some medications and I moved on. Right. They might
Yeah.
not be the chronic, relapsing, searching soul. And I think the same thing is true with the food stuff. There are some people that develop addiction like eating just because they grew up in a toxic food environment
Mhm.
and they probably had some stress and some trauma and some adversity, and their body learned that ultra processed food makes some of those negative emotions go away, and they just became primed for addiction like eating. And there might be some other people who had parents that had alcoholism and that got divorced, and there was childhood trauma and they were seeking and they found food, and that person might need a different clinical approach than the
Yeah.
person who just had some circumstantial stuff. So that's one of the things that I'm able to do that separates me, as I'm a clinician, right? I do this type of work with people, but I also am able to assess when someone might need something a little bit deeper. And
Yeah.
that's where like I might be able to hold space for someone and support them,
Yeah.
right? And I built my app Wise Mind Nutrition to be deep in a sense, right? Like I have some spiritual messaging in there of like not just like, oh, get these foods because they have vitamin A precursors in them. It's more like go to the grocery store and like connect to the plants, like pick the thing that calls your name and get back to nature.
Yeah.
Understand that we are part of nature. Remember who you are. And, I built the app so that I could really cater to some of those old souls.
Mhm.
I'm glad that I did it that way because it's true to me. It's true to
It's true
my
to you.
it's true
Yeah.
to my brand, right? It's what I have to offer to the world. But of course, there's going to be some people like, this is way too deep. Like, I don't want to meditate. I just want a meal plan. Give me a meal plan, dude.
So talk about your app. I mean, I actually just put it on my phone. You can start this app for free.
Yeah,
So
it's
it's Mind. So for those of you, it's Wise Mind
Wise
Nutrition.
Mind, WISE, space MIND, and that comes from dialectical behavioral therapy. The Wise Mind is a description of the intersection mind between the sort of logical mind and the emotional mind, right?
Mhm.
And so the Wise Mind is able to understand the value of both, and it brings together information from different aspects of our being, right? And so I think about the Wise Mind Nutrition as being kind of like the eating disorder, the food addiction, that polarization, and bringing it all together as like a intersection space. And it's designed to use nutrition and lifestyle medicine to improve depression, anxiety, trauma, PTSD, ADHD symptoms. It's really designed for people that have disordered eating and have gut issues.
Mhm.
And I built it so that it wasn't like a single program for a diagnosis, but it was a adventure that would unfold as people went along. So I ask for, once someone subscribes, which is totally optional. As you said, there's a free food log. You can share data with people. There's introductory videos. There's recipes. There's just enough free stuff in there to see if someone likes the vibe. Okay.
Yeah.
And then if you decide to subscribe, there are mental health screening tools that learn much more about you. And then from there, we're like, okay, I'm going to offer some targeted messaging. If I learn that someone has depressive symptoms or a history of eating disorder, we might offer some different ways to think about things. But there's a core set of videos and a core set of assignments, and they are designed to help people think about food in a new way. Of course, like I offer recommendations and I offer some structure, but the goal of it is to have someone kind of come in and create their own meal plan rather than getting something generic. It's like,
Right.
Someone you pick, I'll teach you for 5 minutes about the concept and you pick it, what you want to do. And then it goes into the dashboard. There's a digital workbook. And then after someone completes, the full program, you can see how your mental health scores may have changed over time. And then B, like have sort of created a meal plan, the kind of thing, all the inputs that someone could put into an AI thing and get a 7-day menu. And, I thought about including that in the app. And the only reason I didn't is because my core message is don't get attached to anything. Learn how to live based on principles rather than rules, and practice this thing, and it will revolutionize your life. And it's been changing people's lives. People have gone through multiple times because, it's a little bit much in a few places, and there's scientific references, some stuff that I created just because I'm a scientist that, I felt like needed to be there because it's kind of a new conversation, nutrition for depression. And I just want people to know, like, I'm not making this stuff up. We have 7 randomized controlled
Yeah.
trials to date. You know what I mean? Like, this evidence is happening in other parts of the world. But there's a lot of real simple kind of lay public friendly stuff in there as well. But yeah, I'm still iterating it and improving and adding features and removing a few as well. But yeah, the free version is definitely a great place to start. Well, I'm gonna create some additional perks and features for my subscribers, like monthly webinars and things of that nature. So
Good.
It's super exciting, and yeah, it's great for practitioners too, to learn about nutrition for mental health, get references, steal all my handouts, steal all my recipes, use them
Right.
with clients, and you can follow your clients on the app too if you do.
I saw that. You can share, users can share that with their own providers to.
That's I think the cool part. Yeah. So I have a lot of, and I really built it for therapists and mental health professionals to use clients. Yeah. That's the real kicker, because a nutritionist wants to be the nutritionist. I'm kind of the nutritionist in the app. So if someone is focusing on other things, like really specific things, and wants to outsource the nutrition to someone like me, the nutrition education is in there.
That's a really great idea. Yeah. I know some people I'm going to share that with.
Thank you.
And what was I going to say? Oh, and also for those of you listening and watching, David has shared a free gift, which is, I've got this up here, 5 ways you can improve nutrition in your mental health. And we all have these little free gifts to kind of introduce ourselves to. This is like a free program. You put a lot of good stuff in there. And I'll tell you, my favorite part of this is your spa water.
Spa waters, yes.
I love that as a way to increase hydration and pleasure. I'm printing out the spa water recipes. I love that. So if you're listening to this, I'll put that into the description and links to get that from David. And then you can download his app for free and try it out. I know we've just got a few minutes, and I just want to, there's so much I want to ask you still. Oh, we should talk again.
We should.
The last thing I want to ask you is this. When you do your videos that I see on social media, you have a mural behind you. Tell me, did you make that mural? What is that mural about? Is that meaning, significance?
You're talking about this one.
I don't know. I see you're pointing to.
Yeah, it's not fully in the screen, and I can't adjust the camera.
I think it is.
Yeah. It is a creator on YouTube by the name of After School with a SKOOL, and they basically draw cartoons and animate really important messaging from different scientists and influencers. And I found myself highly in alignment with some of the messages that come out of there. And so I'm a fan. I'm happy to plug After School YouTube channel. They have great content, and I found a lot of really good stuff on there. And one day, yeah, I clicked. You know, when someone gives you a lot of value, you feel like you owe them something. So I bought the thing. I was like, I want to give them my $30. You know what I'm saying?
Awesome.
Here, right. So I'm trying to go along that path and be more of a value-driven creator.
Yeah.
It's hard, like we said, in the nutrition space because of all this stuff, but I would like to step into that in this, you know, in this year, just give so much value that people say, you know what, I want to sign up for that newsletter, and I want to, you know,
Yeah,
try
I'd love to get your tips, like your weekly tips about nutrition and mental health. So yeah, get some weekly tips on. I know I personally, I'm going to close this by saying, I'd say 80% of what I do for my health, in my mind, is for my mental health. That's always my thing. I think we're very similar in a lot of things. That, you know, my exercise is for my mental health. My blood sugar is for my mental health. Everything supports that, because if that is supported for me, everything works. And if it's not, it doesn't. So
I'm right there with you.
I love your message. Thank you so much for sharing some time with us today.
Yeah, the Wise Mind Nutrition newsletter is great at wisemindnutrition.com. And then my clinical practice is nutritionandrecovery.com. And I have a newsletter there that's a little bit more nutrition focused, rather than they're similar, but they're different. So please join both.
Yeah, and I'll have all the links in the description of all this stuff. So just wherever you are, look below and it'll all be there.
Good stuff.
Thank you, David.
You got it.